Hello everyone, this is the musculoskeletal system course. We continue with the lecture today about the bones of the lower limb or osteology of the lower limb. So by the end of this lecture, the student should be able to orient the different bones to their anatomical position, to identify the general features of bone, to name the liable part for fracture, to name the joints of the lower limb. So the primary function of the lower limb is to support the weight of the body and to provide stable foundation in standing, walking, and running. They have become specialized for locomotion. Because the two hip bones articulate posteriorly with the trunk at the trunk sacroiliac joint and anteriorly with each other at the symphysis pubis, the lower limbs are very stable and can bear weight of the body. So, regard the organization of the lower limb, here is divided into regions: the gluteal region, the thigh, the knee, the leg, the ankle, and the foot. And part of this region are compartments, containing compartments, and each compartment has its own muscle, innervation, and blood supply. As you see here in this diagram, this is the gluteal region, this is the thigh, this is the leg, and this is the foot. About the bones of the lower limb, we should know the component of the bones. Here we have the femur, which is a thigh bone, and here we have the patella, which is found within the knee region, and in the leg region we have the tibia medially and the fibula laterally. And then we have this bone of the foot, the tarsal bone, and these are the metatarsal bone, and here this is the phalanx. So started with the bones of the pelvis or the hip bone. So the hip bone or the pelvic girdle, it's very important because it attaches the lower limb to the axial skeleton. It transmits the weight of upper body to the lower limbs. It supports the visceral organ of the pelvis. Some of the strongest ligaments of the body support the pelvic girdle, which are two ligaments, sacrotuberous and the sacrospinous. It's formed by a pair of hip bone called the coxal bone and the sacrum. Together with the sacrum and the coccyx, these bones form the bony pelvis. As we see here in this diagram, it's showing a female pelvis. This is the two hip, this is the right hip, and this is the left hip. And between here we have the sacrum, and here this is the coccyx. And this is the sacroiliac joint between the ilium and the sacrum. And the hip, as we are going to see, is formed of three bones: the ilium, the pubis, and ischium. This red line is representing the anterior-posterior diameter, and here this is the transverse diameter. And this is the male pelvis, and we can now notify the difference between these diameters, the anterior-posterior diameter and the transverse diameter between both male and female pelvis. Also, another difference, we are going to discuss it later. Each hip bone has three parts: the ilium, which is the largest upper portion and often called your hip bone. The ischium, which is the posterior inferior bone, and often called the bone of the seat bone, the bone that you sit on it. The pubis, which is the anterior inferior bone, which connects in front of the at the pubic symphysis pubis. Yeah. The post-pubic bone connected at the symphysis pubis. The acetabulum is the point of fusion of all these three bones, and here this is called the hip socket. As we mentioned, there's three parts. This upper part is the ilium, and here this is the pubis, and here this is the ischium, the part where you sit the seat bone, and this is here the acetabulum, the site for articulation with the head of femur and formation of the hip joint. So again, these bones, the ilium, the pubis, the ischium. Let's talk about the hip and further smaller structure. The bone in yellow here representing the ilium. As we see here, we have the iliac crest. This is the iliac crest representing the highest part here of the ilium, and here this prominent part of the crest we call it the tubercle of the iliac crest. Here this is anterior and this is posterior. So anterior, here we had this spine which we call it anterior superior iliac spine or ASIS. And here this is the anterior inferior iliac spine. We have another two spine posterior, the posterior superior iliac spine and the posterior inferior iliac spine. So this lateral view of the iliac, as we see here, the gluteal line. This is the anterior gluteal line, and here this is the posterior gluteal line, and here this is the inferior gluteal line. So we have three lines, and all of this here is called the wing of the ilium, and we call this surface the gluteal surface. If we see it from medially, again this is the iliac crest. This is the inner or internal lip of the iliac crest. This is the anterior superior iliac spine, and this is the anterior inferior iliac spine. This is the posterior superior iliac spine, and this is the posterior inferior iliac spine. As you see here, this is the articular surface of the sacrum. So the sacrum articulate with the ilium. This is the iliac tuberosity. And here we have the iliac fossa. Iliac fossa. So from outside the surface, gluteal surface, from inside we had the iliac fossa. We had this line here, which is the arcuate line. It's found it here. So this about the ilium. So let's move to the pubis. The pubis, here we had the pubic tubercle, and here we have the superior ramus, and this is the inferior pubic ramus, and here this is the pubic crest. Okay, can see it here. Yes, and the seed bone or the ischium, as you see, it's containing posterior here. This is the ischial spine, and here this is the body of the ischium, and this part of the inferior ramus formed by the ischium. So this is the ramus of the ischium. So ramus of the ischium, ischial tuberosity, and ischial spine. Don't forget to notice these two notches here. This part, the greater one, we call it the greater sciatic notch, and the smaller here we call it the lesser sciatic notch. Later on we will know that this two notch will change into foramen by two ligaments. Again, this is the pubis and this is the ischium from medially. So this is here the symphysial surface where the two pubis bone united together. We have the symphysis pubis at this side. This is the inferior pubic ramus, and this is the superior pubic ramus. This is the pubic tubercle here. As you see here, this is the obturator groove. This we call all of this foramen, we call it the obturator foramen, and this is here the obturator groove. And this line here is called the pectineal line. Pectineal line. Again, this is the ischium. This is the body of the ischium, ischial spine and tuberosity, and this is the ramus. So we already discussed the different part of the ileum in the previous slides. The ischium also we had mentioned this part. So this is a common injury to the hip. As you see here, this is a dislocation, posterior dislocation of the hip joint. This you see here, this is acetabular fracture. Small rim of acetabulum had been fractured here. Also commonly to have different pelvis fracture. For commonly fracture is superior ramus and inferior ramus. Also we had fracture to the iliac, wings, and even the ischial and inferior ramus can be fractured. As you see here, the pelvic fracture, as we mentioned, sometimes could be just ligamentous injury. Anterior and the posterior ring will be disturbed. As you see here, this is the symphysis pubis and this is the sacroiliac joint. This is the two ligaments here, the sacrospinous and the sacrotuberous ligament. Yes, and as we see also here, this is another injury, ligamentous injury, and here we can call it open puck pelvis. Open puck. Here, this part of the pelvis, turn it or laterally, and it can be described as an open puck pelvis. This is another type of the pelvic fracture. Here, anterior superior ramus, and here posterior fracture of the ilium and involvement of the sacroiliac joint. So we move to the bone of the thigh, which is the femur, which is bone here in the yellow. The longest and strongest bone in the body. It receives a lot of stress. It courses medial, more in women. It articulates with acetabulum proximally, and distally articulate with the tibia and the patella. So we have these features and structure of the femur, the head, the neck, the greater and lesser trochanter, intertrochanteric line and crest, the linea aspera. We are going to see them in the diagram. As we look here, this is a slide showing the right femur. This is the head of the femur, and here this is the neck of the femur. This is the greater trochanter, and this is the lesser trochanter. This is the shaft of the femur. As you see here, between the greater and lesser trochanter, we had the intertrochanteric line. Posteriorly, we had the intertrochanteric crest. This is we call it crest. Posteriorly, anteriorly, it is the intertrochanteric line. And here we have, this is the linea aspera. And this is the gluteus tuberosity. This is in the posterior surface of the femur. If we go distally, here we can see this is the medial condyle and this is the lateral condyle. In the top of the medial condyle we can see a small tubercle here. We call it the adductor tubercle. Adductor tubercle. If we look to the posterior, here we have this surface, which we call it the popliteal surface. The popliteal surface, and again this is the lateral condyle, and this is the medial condyle, and this is the adductor tubercle. Again, this is another diagram showing the femur, which is very important to know. At the head of femur we had this small cavity here, we call it the fovea cavities, which represent attachment of the ligament teres. A common fracture of the femur is fracture neck of femur, as we see in this slide. Here the neck of femur had been fractured, which is very common in elderly persons. And here also another common type of fracture is the intertrochanteric fracture. Also we had shaft fracture, as you see in this slide, spiral fracture, and even we have distal femur fracture, which can be sometimes involving the knee joint. So this is representing a femur shaft fracture, and as we see, the acting muscle will displace the fragments. As you see here, we have very strong iliopsoas muscle, psoas major and iliacus. It causes flexion of the proximal fragment upward. So very strong distracting forces act on the femur. Very important is to know about the blood supply of the head. As you see in this diagram, the head receives its blood supply from the middle circumflex artery. We have the medial circumflex artery and the lateral circumflex artery to supply the head. As you see here, this is the teres, ligamentum teres, and also here we had an artery came and supplying the head. Also, this is a common type of fracture, the fracture neck of femur, which include the one under the head, we call it subcapital, and the one here in the middle of the neck, we call it transcervical, or could be at the base of the neck, and we call it basal. And here this is a pretrochanteric or intertrochanteric fracture between the two trochanter, greater and the lesser trochanter. And as you see, how does this fracture can disrupt the blood supply of the head of femur, leading to death of this head. We call it the necrosis, avascular necrosis of the head of femur. So we move on to patella. As you see, this is a patella, the anterior cap of the knee. It is a sesamoid bone. It's found it here in the tendon of the quadriceps muscles, which is one of the anterior compartment muscle of the thigh. As you see, this is the anterior surface, and this is the posterior surface of the patella. And we see here, this is the apex of the patella facing downward. So the apex is facing downward. And we see the posterior surface of the patella, its articular surface, which articulate with the distal femur. As we see here, this is the facets for the medial condyle of the femur, and here is the facet for lateral condyle of the femur, and here this is the site of attachment of the patellar ligament. And the anterior surface is usually rounded and convex, and the posterior surface, it is smooth and it is articular surface. So we move to the bones of the leg. The bones of the leg include the tibia and the fibula. As you see, the bone, the larger and the one medial is the tibia, and the smaller and the lateral is the fibula. So these bones are connected by the interosseous membrane. So they receive the size and the weight from the femur. About the tibia, we had the medial and the lateral condyle. We had the intercondylar eminence between these two condyles, and we have the fibular facet just below the lateral condyle, which articulation of the fibula. And also we had the tibial tuberosity, the shaft or the body, and the medial malleolus, which is found distally at the ankle joint, and the fibular notch also which is bounded distally and articulate with the fibula. Here we can see this diagram. This is the medial condyle of the tibia, and this is the lateral condyle of the tibia. Here we have a small tubercle here. We call it the Gerdy's tubercle for insertion of the iliotibial tract. We are going to talk about it later. Between the two condyles here we have the intercondylar tubercle, the medial and the lateral intercondylar tubercle. Here this is the tibial tuberosity, and here we have the oblique line of the tibia. So here we have the lateral surface of the tibia, which facing the fibula, and this is the medial surface of the tibia, which is just found below the skin, subcutaneous. We have no muscles here, just subcutaneous and beneath the skin. And this is the anterior border of the tibia between the two surfaces, the medial and the lateral surface. This is again the tibial tuberosity, which represent attachment of the patellar ligament. Here this is the medial malleolus. Here this is the region of the ankle joint. This is the distal tibia, and this is the ulnar notch. Here the fibula, and this is the apex of the fibula, and here this is the head of the fibula and the neck of the fibula. The narrow area after the head is the neck, and then again this is the shaft, and also in the shaft we have medial surface. It's a triangular bone, so we have the medial surface and we have a lateral surface. As you see here, we have a border, the interosseous border. This is the interosseous border, and this is the anterior border. So this anterior border is found between the two surfaces, the lateral surface of the fibula and the medial surface of the fibula. And posterior we have posterior surface of the fibula. And distally here we have the lateral malleolus of the fibula. And this is the articular surface of the ankle joint. Again, here this is a posterior view. This is the lateral condyle, and this is the medial condyle, and this is the intercondylar tubercle, the lateral and the medial one. And here we see this is the shaft of the tibia. As you see here, we have a posterior line running from lateral to medial, from downward, which is the soleal line. The soleal line is here. Here, this is the posterior surface of the tibia, and as you see here, this is the posterior, and this is the medial malleolus, and here these are grooves for the muscles, the flexors muscle of the posterior leg. Also, this is the posterior surface of the fibula. Very important to notice this fossa of the lateral malleolus of the fibula. If we look to the tibia and the fibula from upward, you can see again This is the medial condyle, and this is the lateral condyle. This is the head of fibula, and here is the apex. The apex a little bit posterior. And as we see here, this is the tubercles, intercondylar tubercles, the medial, and this is the lateral. And here, this is the tibial tuberosity. And this is the lower part at the ankle joint or articular surface. This is the medial malleolus, and this is the lateral malleolus. And again, you should notice this, the fossa of the lateral malleolus, which is posteriorly here. So this is the inferior articular surface of the tibia, and this is the inferior articular surface of the fibula. And these are ligaments, anterior and posterior tibiofibular ligaments. A common site fracture is the midshaft fracture, tibia and fibula. Usually they are combined together, as we see here, or could be even segmented fracture or simple diagonal or oblique fracture, as you see here, which is a very common is to notice simple fracture of the tibia usually associated with a wound in the skin, and in such case we call this fracture open fracture because it's open to the external environment, and this is why we call it open fracture. And even the management is different from the normal or closed fracture, and which is make it commonly because the tibia, as we mentioned, is just subcutaneously, especially in the medial surface here. It is just beneath the skin. Also, a common fracture at the distal tibia and fibula, ankle fracture. As we see, this is the medial malleolus fracture, and this is the lateral malleolus fracture. So we move to the bones of the foot. Bones of the foot, including the tarsus bone, which is here, and the metatarsus bone, which is here, and the phalanx or toes. We have found it in the toes. So the foot is very important because it supports the body weight and act as a lever to move the body forward during walking and running. Again, here this is the tarsal bones, metatarsal bone, and the phalanx. The tarsus bone, including the talus. Here the bone articulates with the tibia and fibula at the ankle joint, so we call it sometimes ankle bone. And here we had the calcaneus, also known as the heel bone. Here we had the navicular bone, and lateral to it we have the cuboid bone. Then we had these three bones, the medial cuneiform, the lateral intermediate cuneiform, and the lateral cuneiform. So we had 7 tarsal bones. If we go to the metatarsal bones, we had 5 metatarsal bones. They are long bone, so they have shaft, head, and a base. This is the first, and this is the 5th metatarsal, 2nd, 3rd, and 4th. The phalanx, as we see here, we had the proximal phalanx, the middle phalanx, and the distal phalanx. All the lateral toes having 3 phalanx, except the big toe, only containing proximal and distal phalanx. Here there is no middle phalanx in the big toe. The lateral view, This is the calcaneal bone, and this is the talus. This is the navicular bone medially, and the cuboid bone laterally. And this is the three cuneiform: the lateral, the intermediate, and the medial, which is not apparent here. This is the metatarsal bone, and here this is the phalanx. This is the proximal, medial, and distal phalanx. And this is the medial view. Here we can see this is the distal phalanx of the big toe, and this is the proximal phalanx of the big toe. This is the first metatarsal. This is the medial cuneiform. Navicular bone, the talus, and the calcaneus. And as you see here, this is the medial longitudinal arch of the foot. And here this is the lateral longitudinal arch of the foot. Again, this is the bones, and as you see, the ligaments exist between each bone. So this is the tarsus bone, and the different parts of this bone: navicular, cuboid, then the cuneiform bone. We already talked about this. And here this is the arches of the foot: the medial longitudinal arch and the lateral longitudinal arch. And here lastly we have the transverse arch of the foot. And also we should know the names of the joints of the lower limb. And later on, inshallah, we are going to know the more details about this joint. The joints here we had the sacroiliac joint, and here we had the hip joint or the coxal joint. This is the knee joint, ankle joint, and here this is even the small joint, the proximal tibiofibular joint and the distal tibiofibular joint. All of this we are going to speak about them later on. So this is a plain X-ray of the pelvis, showing the bones of the pelvis. As you see here, this is the pubic bone, superior ramus, inferior ramus. This is the obturator foramen. Yes, and this is here the ischial spine, and this is the lines, the arcuate line, and this is the pectineal line, and this is the acetabulum. This is the head of femur. This is the ilium, and the top here we have the iliac crest, and this is the side of the sacroiliac joint. This is the sacroiliac joint. And here this is the sacrum. You can see this is the lumbar vertebra, lumbar L5 and L4. This is the neck of the femur, head, lesser trochanter and greater trochanter. Between the two pubis, here we have the symphysis pubis. This is an X-ray of a child with congenital hip dysplasia. As we see here, the head of femur is not developed and the acetabulum is shallow. Again, this is a plain film showing also the hip joint, and you see some osteoarthritic change, osteoarthritis of this hip joint. And here this is showing a fracture of the shaft of the femur with big segment here, you can see. The knee X-ray, this is the distal femur, and this is the patella, tibia, and this is the fibula. And even in the anterior posterior X-ray of the knee, we can see this is the femur, medial condyle, lateral condyle, and this is the tibia. This is the intertubercular eminence, fibula. This is the knee joint, as you see it, and even the patella can be seen in the anterior posterior view. So, also this is the lower limb. As we see here, this is the tibia, and this is the fibula. And as you see here, this is a fracture of the tibia. You see multi segments, and by some sort of the external fixation. And here this is radiograph of the lower limb. As we see here, this is the tarsus bone, the calcaneum, the talus, the cuboid. This is the navicular bone, and this is the cuneiform bone, the lateral and the intermediate cuneiform. Here you can see this is the medial cuneiform, and this is the navicular bone. This is the phalanx, the proximal phalanx of the big toe, and this is the distal phalanx of the big toe. Thank you so much.